The one in particular that I have used is iInject. And it was expensive. It was like $5, which in the land of apps is expensive. And it was horrible, and I was really disappointed within literally 10 minutes of downloading it. Another one that I tried, Beta-Seron, which is a pharmaceutical company for MS medication, has their own app for using Beta-Seron. Unfortunately, I don't use Beta-Seron. I use another app or another medication which doesn't have an app. So I was like, oh, well, maybe I can use Beta-Seron's app to work for my other medication. Well, that didn't work either. But the app that Beta-Seron has is a free app, and it was actually pretty good from what I could tell. I actually wish I could have used that app because it seems like they at least got the idea of the injection itself and how it needs to rotate and the practicality of it. At least seems like they nailed that part of it.
These aren't apps, but the software that comes with glucose monitors and insulin pumps, and the data is, I mean, some of it's useful, but it seems like whoever imagined collecting the data and how they would show it to it seems like it was imagined by an engineer and not a person with diabetes or a person who actually has to look at the data. I've watched my daughter's endocrinologist and the nurse practitioner make the same face as I make when you bring up the screen full of data. They're like, there's lines and graphs and charts everywhere, and honestly, they'll come up with a cure before we all figure out how to read it and then use that information to make a real difference, with our kids. So my daughter's CGM, her continuous glucose monitor, the report that it gives is extensive but meaningless because it's too much, it's layered on top of itself, and it just, again, it would need to be your part-time job to sit there and figure it out. So you end up using the simple graph that's on the front of the monitor as you're using it. And that's my fear with most of this stuff, is that it's designed by somebody who doesn't have the disease or doesn't live with it, and therefore they're just guessing what you need.
I think that mobile apps could be, if they were better individualized and customizable, a really effective way to communicate with your doctor. If that alone, I mean, there's certainly when there have been opportunities to build bar graphs out of things and whatnot based on the information that you've entered, but also just the tracking symptoms and side effects you may be experiencing from some of the medications, etc. I mean, there's a lot of value in being able to get that information to your doctor. And if there was the possibility, I haven't found one yet, to gather the information and email it even, send it. However, if your doctors, in fact, communicate with you via email, which mine does, or the nurse clinician in the office, then you can have it all together. Well, before I come in for my appointment, take a look at these. This is what I've been experiencing, and I look forward to discussing it with you. Because then they're better prepared, and you don't have to worry about the emotions of the appointment itself and whatever you're thinking, or if you're exhausted, you don't have to worry about everything to be communicated. And that would be a really effective tool that I have yet to find. It would require a certain amount of customization in terms of the type of information that you're that you're storing. Something with notes.